We're the Independent Health and Aged Care Pricing Authority, and we set the national efficient price, helping to determine levels of government funding while providing an efficient cost benchmark for public hospital services. To do this, we depend upon accurate and reliable data, but identifying it takes time. So too does collating it and making it accessible. That's why the Australian Hospital Patient Costing Standards, or AHPCS, were introduced over a decade ago to outline best practice in generating high-quality, reliable and comparable patient-costed data that helps us refine classification systems, set prices and inform policy. The AHPCS is updated periodically to make things clearer for everyone, and that includes you. The AHPCS consists of 3 documents. There's the standards themselves, the business rules, and the costing guidelines. Together, they provide greater clarity. Let's start with the standards. These are the principles that inform each of the 6 stages of product costing, from identifying relevant expenses to creating the cost ledger and putting final cost centres together, from identifying products and assigning expenses to them, to reviewing and reconciling. At the beginning of each stage, there's a description of what's involved. You'll clearly see the applicable standards and business rules. Following this process will support you in assigning costs to patients in a way that reflects the resources they have benefited from more accurately. Whether the data lies within your organisation or in your respective jurisdiction, following the standards ensures greater precision in the data available for everyone. The business rules provide practical guidance and consider how a standard can be translated into action. We realise there are practical and operational constraints faced by costing practitioners. The business rules take these variations into account. Definitions are provided to assist with the costing of more complex services. From the general ledger to the final reconciliation, the business rules outline the costing process. The third document is the costing guidelines. These have been developed to help with the costing of specific services within your hospital. They outline 9 practical steps to address the relevant business rules within each stage of the standards. They've been developed to reflect the needs of Australian hospitals at this moment in time. The nuances of your hospital and jurisdiction are important, and these variations will impact how the costing methodology can be applied to your local environment. The Australian Hospital Patient Costing Standards will continue to be updated and improved upon as processes develop, and each version is designed to be more closely aligned with the needs of product costing for Australian hospitals today. Its application will support the work of hospitals, regulators, funders and researchers, providing a clearer picture of costs within Australia's hospital system and informing better strategic decisions for everyone. Visit the AHPCS website today and access the latest version of the Australian Hospital Patient Costing Standards.